Hello and welcome to Healthcare Unfiltered. I am Suksham Sharma, your host for today, as I'm joined by Dr. Rajan Sahu, who is the Associate Director, Robotic Surgical Oncology at Paras Health Panchkula. Cancer is on rise if we talk about the younger population also. What can be the reasons of that?
Cancer per se is also on the rise, and recently we have seen that cancer incidence is rising in the younger population. The reason being that the cancer starts from one cell. There happens a mutation, these mutations then accumulate and then they take the form of a cancer. That process takes years to develop. So cancer doesn't happen in days or weeks. So it used to happen that the mutations are accumulating, taking the form of cancer, and it used to manifest in the 60s or 70s years of age. Nowadays, we are seeing patients in 40s, 50s, and sometimes even younger than that. Main reasons for that are that lifestyle changes, like use of tobacco is on the rise, use of alcohol, sedentary lifestyle, obesity, use of ultra-processed foods, saturated fats. These are the main reasons because of which the cancer is rising in the younger population. And yes, detection rates are also increasing. So we are finding cancers in younger age also. There is one peculiar thing about the cancers in younger population is that these cancers are usually aggressive cancers. The cancers we see in the elderly population, like when we talk about breast cancer, the cancer found in elderly people, they are slow-growing tumors, usually hormone-positive tumors, which behave better. But at younger age, the cancers are very aggressive and many times they do not respond to the traditional treatments of the cancer. So this is how it is different in the younger population.
So talking about the early signs of cancer, what are those very common, early signs that we usually, on day-to-day basis ignore?
Because patients, they tend to come to us at advanced stages of the disease. And when we ask them that why didn't you come earlier, तो पेशेंट्स का एक बड़ा ही कॉमन सा जो रिप्लाई रहता है कि हमें पहले पता नहीं था. सो पेशेंट, द जनरल पब्लिक, दे शुड बी अवेयर अबाउट व्हाट आर द वार्निंग साइंस ऑफ द कैंसर. सो व्हेनेवर आई हैव टू एक्सप्लेन दैट वी मूव फ्रॉम द हेड towards the foot and how these symptoms appear in the body. So any abnormal swelling which a patient has noticed, or any swelling which was existing for some years but now has changed, it is increasing in size. So those should be the warning signs of cancer, like say breast lump. If it has been there for quite some time but now it is increasing in size, or any new lump. So patient should be cautious that it can be malignancy, it can be cancer. When we see that in smokers, there is usually a nagging cough going on for years. Any recent change in that cough, any recent change in the pattern, or appearance of blood in the sputum, they can be the sign of the cancer in the airways or the lungs. Any ulcer in the mouth which is not improving in 2 weeks' time, that should be investigated. Similarly, hoarseness of voice or change in the voice of a person, that can also be a warning sign for cancer, especially of the voice box. Similarly, difficulty in swallowing. Say patient has encountered some difficulty in swallowing. Initially, he was able to take the solids normally. Now he has to take liquids along with to swallow that bolus of food. So that can be a sign of the malignancy of food pipe or the stomach. Then abnormal bleeding from other sides, like bleeding other than the menstrual bleeding in females, bleeding along with the stools, blood in urine. These are also warning signs for the cancer. Any unexplained loss of body weight. Patient is not trying himself or herself to lose the body weight, but he is feeling that उनका वजन गिर गया है, तो ये भी एक कैंसर का लक्षण हो सकता है. So these are the common symptoms or the warning signs which a patient should not ignore, and he or she should consult the nearest doctor or the specialist.
Sir, क्या कैंसर विजिबल सिम्टम्स के बिना भी हो सकता है और से विदाउट पेन भी हो सकता है?
Most of the cancers, they are painless to start with. Most common cancers like breast cancer, So the lump which is cancerous in the breast, they are usually painless to start with. Pain happens only when the disease is advanced. So पेशेंट को सिर्फ ये सोचकर कि उसको दर्द नहीं है तो उसको लंप को इग्नोर नहीं करना चाहिए. And likewise, other cancers are also, to start with, they are painless. Pain usually starts when the disease spreads like to some nerve structures or somewhere else in the body like bones, etc. So usually they are painless. And the cancer starts from one cell only. So to appear clinically, it takes time. So there may be some hidden cancer in the body, which we have to detect by some special tests. We call them as screening tests.
How early diagnosis, plays a role in this whole process and how it changes the outcome of cancer treatment?
You must have heard that whenever we discuss about cancer, we talk of stage of cancer. So usually it varies from stage 1 to stage 4. So 1, 2, these are initial stages. 3 is the intermediate one, and 4 we can say that then the disease has spread to the other organs of the body or the distant sites we can call. So the prognosis or the outcome of the cancer depends upon the stage at which the patient presents to us, the stage at which we start the treatment. So early diagnosis is the key. We are treating a patient at stage 1, he behaves much better than the stage 2 and similarly. So stage 4, usually we are not able to achieve cure. So early detection is the key. The earlier we detect the cancer, the better results we can achieve. And in fact, in most of the cancers, we can cure the disease if it is detected.